Okay, hi everyone. I'm not sure if it's good or bad, you cannot see me, probably it's good. So I'm really sorry I couldn't be with you today for unforeseen circumstances. And I'm really, really grateful for this opportunity to share the learning from COVID in your summit. Let me just go to slideshow from the beginning. Okay, so I'm going to cover today the COVID challenges from the start of the pandemic, and then I'm going to give you an overview about our SIG and the action plan we developed to work or to support the SIG response in the Sudan and within the UK amongst ethnic minority groups within the UK. I'm going to focus on two learning areas around leadership and around mental well-being. The slides of mental well-being is done by our new joint fellow, which is Dr. Sarah Bell, and unfortunately she can't be with you today as well. I'm talking here from the start of the pandemic, okay? The challenges are when we started, we had a highly spreadable infection. It's still highly spreadable, by the way, especially Omicron 4 and 5. And when we started, there wasn't an available cure, or the vaccine weren't available from the start. There were sudden increase on the need of PPE and other resources measures and healthcare resources. And then we felt very early on in the pandemic that controlling the spread of the virus will depend on the population compliance, okay? Because there was lots of self-care and control measures people had to exert. And also the psychological and economic impact were at a scale we weren't used to in the past. And then the rollout of a mass vaccination program was something really, at least it was the first in my career in public health. So what did we do? The SIG Sudan is a professional group. To join the SIG, you have to be either a member or a fellow of the Faculty of Public Health. We have a chair in the Global Health Group of the Faculty of Public Health, which is chaired by the lead of the Global Health in the UK. So it's quite a powerful group. So at the beginning, we came together and we decided to we do have an annual action plan or working plan every year, but we decided to change that to cover COVID. So our action plan were divided into what is the objective, who we are going to work with, what are the actions, who is the lead, and the degree of the time frame, and also what would success look like in terms of the outcomes. Our first action, we want to support the clinical response and the management of COVID. Our partnerships with the community medicine specialists in Sudan and the diaspora. And the actions, we want to align the subgroups, divide them into subgroups, make them aware of the WHO resources, and also additional resources from all over the world and the diaspora. So what we did in terms of the outcome, we developed modules and in liaison with community medicine and the diaspora, which is around training and case management, infection prevention and control, around surveillance, and around risk communication. So that was one of our starting points. And another, also one of the main actions, which is we raise awareness around the management of COVID, and our partnerships were media, resistance cells, were different cells, schools, and lay communities. So we did work with Sudan COVID platform. We developed a number of audio messages and also visual messages. And we collaborated with the Sudanese Doctors Union in the UK. If you remember, we had a meeting and then it was a formal collaboration. And also we collaborated with Baladna Initiative. The outcomes were like the media messages developed and broadcasted through various platforms, and effective partnerships with stakeholders were developed. Other objectives in the we advocated for embedding public health principles and multidisciplinary working in clinical nursing and health professions. So we took that opportunity to highlight the importance of multidisciplinary working. We focused on priorities, non-infectious diseases or long-term conditions, mental health, cancer prevention, and the role of primary health care. We have a number from the SIP members who are GPs as well, and they are very active in the primary care group. And we lobby for political action, okay, for circuit breakers and legislation, basically the lockdown and all those. Muna, our colleague, she took part in 5 minutes ideas from expert to ministers arranged by Professor Allam. وI think it was كانت مع مجلس المهم عائشة اسمها ماما عائشة من ما أعرف نسيت اسم المجلس. وبعدين we sent an open letter to our own MPs to support this approach. Then, in terms of looking at the lessons learned from COVID globally, it's a whole society issue and a problem. The power of science. We learned a lot around the power of science and the ability to develop a vaccine within, I don't know, 36 months or less. 12 months, I think, or 18 months. And the need for global equity on vaccine. These are all highlighted. And the need to build trust across, especially with communities. The need for agility and speed of delivery. At some stage, we have to work really very fast to keep up with the speed of spread of the infection. Policy, government policy matters. So we needed legislations and we needed guidance and also ways to enact those legislations. And then where we are now is how the system will behave if the same problem again, which is the recovery. We are working very hard on the COVID recovery at this stage. This is in terms of global learning. In terms of, as I said, I'm gonna focus on two aspects. The leadership first, and then the mental health and well-being, the learning. And the leadership, I think this is the learning from the UK, and this is in the future, when we face the same problem, this is what we need to do. And I'm hoping Sudan will be able to benefit from these lessons as well. The first, the leadership challenges we face, we needed to influence at a scale, cutting across countries, systems, and organizations. It was no longer just a defined infection. We needed to work in a very uncertain circumstances. We needed to manage demand and resource and scarcity. We needed to build a strong partnership at all levels, and we needed to think differently and have a strong focus on reducing inequalities and of COVID comorbidities and mortalities, actually. But this is what faced us as a public health community when at the start and throughout, we are still facing number of uncertainties. So the first thing when we are faced with such a problem at a scale, to develop the ecosystem or to look at it from a very wide scale. The COVID ecosystem it has its population at the center. So you need to think about your population. Health is one aspect of the ecosystem, but the economy is another. The media is, education, the education system, law and order, which is the legislation, and the academia and the research. So we need to work across all those, and the levels, it's a global, because it was a global pandemic, national, and then the local. So this is, the first thing is starting to look at the bigger picture. The second thing is, how are we going to, as I said, one of the learning is, or one of the challenges we need to influence at a scale. So the first thing is you need to think and act as a system, which is the system leadership. It's around mindset. So system leadership, the main skills start with yourself, and you have a system in your mind. You understand you are part of a system, okay? And you can influence only that part, but you can work with the domino effect. So you influence one part, and that part will influence the other. It's a professional style, because how you conduct yourself amongst your partners and amongst the system, it's about developing relationships, and it's about enabling behaviors and actions, enabling behaviors and actions of the whole system. And you can, if you remember the WHO, the relation between different surveillance system across the globe. One of the mantra of system leadership, I lose as an organization and we win as a system. And I think this is one of the things which we haven't seen in Sudan in managing COVID. There was a drift between Ministry of Finance and Ministry of Health. They didn't think as a system. And each one wanted share of the money, rather than look at the problem as a system. And I'm not sure if they develop effective partnerships with the media, especially. So that's the first one. The second one, if you remember, in the challenges, we needed to work at a scale and at a speed. Okay, so then it is the agile leadership. The agile leadership is a leadership that works across boundaries, and it focuses on demand and scenario shift. It is task-orientated and relationship-focused, and used to create virtual networks, teams, and innovation. One of the things we learned from COVID really, it's around agile leadership, is the working virtually. And now I'm working virtually with you. So when we look at the details of how do I practice agile leadership in such a very moving situation, fastly moving situation, first you have to be flexible in your direction. It is not one, you might need to change direction in the middle. And if you remember in COVID, there was first the chloroquine and others, and we had to change because we were learning by trial and error. We had to move very quickly, calculated speed, very fast, but you have to get it correct as well. And we had to align resources effectively. We have to focus on the strategic thinking, but on the operational delivery. What are we going to do strategically, but how are we going to do that on ground? And the leading from within. And greater team participation. And simplifying the decision-making process. For example, in our local authority, initially, now in local authority, there are red tapes. If you want to spend anything, say, above 25,000, you have to develop a decision sheet, and it needs to go to this and this and this for audit purposes and for financial governance. But we had to remove all those because we had to move in a very fast pace. And then very quickly we realized as a public health committee, we cannot manage COVID on our own. We had to inspire others across the system, including communities, and learn to work very closely with communities. One of the main learning from COVID is how to work with communities, how to get the trust or achieve community or build trust with communities. And then one of the things we had to face, which is the fake experts. I mean, you all know the fake experts in COVID and all those myths and all those conspiracy theories. And this is something we didn't have to deal with a lot in the past, but in here we had to do it, and we had to do it very quickly. And then, in terms of productivity, I'm sure you all feel the same. We felt like we are running a marathon for the past, I don't know, 24 months, and we are still, by the way, because the rates are increasing. So we needed to focus on productivity. What is the maximum you can get from that team, but at the same time you balance the team need to have rest and the team need to look after their health, which is really then that led us to the tools of transformative leadership. Again, the flexibility, promote flexibility, trust and autonomy, giving the staff autonomy. In COVID, we didn't have the time or the luxury for the staff to wait for the director or the head of service or their manager to approve something. So we gave them total autonomy because we needed to move at a pace. And the autonomy goes with it. We have to encourage, support, and motivate, and staff being able to innovate and run the extra mile. That was one of the fantastic learning from COVID. And then the focus on productivity. I like this slide. So if you can see, square one, equal time, equal return. That's necessity. Okay, there are necessarily things we have to spend time, but the return would be the same. Quarter three, which is the distraction, a lot of time and energy with much less return. We shouldn't be in quarter three, but people who are not aware or mentally aware of productivity probably spend a lot of time in quarter three. In quarter four, this is a lot of time and energy and no return, and this is when we waste our productivity. Where we want to be is quarter two, which is time and energy. When you spend time and energy, the return is much higher, 3 times or 6 times your time and energy you spend on that. So this is just a slide to show the concept of productivity. And as I said, that was one of the major lessons because we did have the staff we had. There wasn't any additional staff you can employ, even if you got the money. The government gave us a lot of money, but the public health staff became very scarce on ground because a lot of people were employing people. So we had to make the best use of the staff we got and to focus on productivity. So how we did that? About prioritization. We stopped a lot of non-COVID work, which is we are able to stop it. Provided much clarity on roles and responsibilities, clarities of expectations from you as a manager or from the organization, clear and simple communication. This is really important. Communication is important, but the simplicity and clarity is really important. There was no time to waste on ambiguous communication. We have to focus on solution-focused mind. We are in the here and now. Even if there were mistakes, and mistakes do happen, especially when you are working at a scale. So you tell the staff, we are in the here and now, what can we learn and how we can move forward. Delegation is a good way of managing productivity. Project management tools, these are very important, and the resources, and identifying community drivers. And we did that with Sudan, seriously, which is all the community groups we worked with. Yourselves as the Sudanese Doctors Union, you were one of the drivers and the tools we collaborated with to maximize the spread of our message. You did have access to the national TV in Sudan. We didn't have that, so by doing a message, the reach is very high, but through collaborating with yourselves.
I have 5 minutes alert.
Okay. In terms of one of the learning, we are all in this together, and the WHO said that. So the togetherness and the thinking as a system has been highlighted by COVID. So these are the mental health aspect. As I said, these are by Dr. Sarah Bilal. We did also a number of engagement, either as a SIG or SDU UK or others, in terms of to look at the impact of mental health. And as Sarah said, it's especially the lockdown, there was an issue of boredom, depression, which manifested in substance misuse. We as I said, we conducted a number of question and answer sessions, and the causes, what worsened mental health as part of the pandemic, there was the domestic abuse, job and finance, security, and others. And these are Sarah's tips to stay mentally well around your sleep, lifestyle, limit your screen time, and practice mindfulness and develop resilience. Sarah has got a very nice slides on resilience, which is the definition is ability to adapt and bounce back from setbacks. And this is another slide on how to develop resilience. You need to maintain perspective, set yourself some goals, build your self-confidence, develop strong relationships, and be flexible. One of the things also we focused on, and Sarah is our mental health lead, and I just wanted to congratulate Sarah on becoming a fellow of the Faculty of Public Health, and she's been working with us actually from the start of the pandemic in partnership, and now she got the fellowship. So now she's an official member of the SIG. And to improve mental health at a population or at a scale, it is the 5 ways to mental well-being, which is we tell the population to connect, to keep learning, take notice, they give, and be active, which is the lifestyle. So that's me, and these are the references. So I'm happy to take any questions if there are any questions. And once again, I'm really sorry. I hope I was able to see you all and you see me, but الجايات إن شاء الله المرة الجاية.